Right. Good morning, everyone. My name is Dr. Amrita Singh. I'm a psychologist at the Mailman Siegel Center for Human Development, specifically within the Unicorn Children's Foundation Clinic, the Developmental Assessment Clinic. I typically do evaluations for autism and for developmental delays, but today I'm here to talk to you about different strategies that you can use to support your teen for coping during this COVID-19 pandemic. I'm here with two of our doctoral students, Kayla Schrickle and Catherine Taylor. Um, Today we will be discussing and reviewing different stressors that you're experiencing currently in the home. We'll also talk about a lot of self-care strategies as well as some behavior management skills. And we're going to discuss ways that you can support your teen's coping skills. I'm going to turn it over now to Kayla.
Hi, everyone. So, as you all have probably noticed, there are a lot of stressors that you as parents are facing surrounded COVID-19. So, you may be working from home, you may be dealing with not only parenting your child, but now also being their teacher. You may have more than one child to be dealing with, or a child with medical issues, or more than one issue going on. There may even be some families with a member in the house who's positive for coronavirus. So social distancing needs to be enforced in the house as well. So while there might be a lot going on in our lives at this moment, today we're going to focus on how we can bring down your stress levels as well as your child's during this pandemic. So first we want to talk about some self-care. So first of all, you as parents need to keep in mind your own self-care practices and how you can manage your own stress. However, there are a few different ways that we can also manage your children and their stress right now. So the first place to start with is by listening to your child's feelings and by validating them. So practice listening to them and reflecting back what you just heard so that they know that you're listening instead of engaging with in a tug of war with them. So for example, saying things like, I get it, you really don't want to do your homework right now. I understand you're feeling really tired, but what can we do right now? What can I do to help you get through this assignment so that we can take a little break after? So this is a good way to validate your child's feelings as well as help them come up with solutions and problem solve. So you also want to control as much as you can in trying to maintain your regular habits and routines. So having your children wake up at the same time on weekdays and getting them dressed and having them sit down for breakfast, these are all things we can control in our home and really help maintain that structure. You also want to schedule breaks throughout the day as a reinforcer for your child. So this will help because they may be more motivated to work up until that break, but you need to make sure that the breaks are consistent and that you explain the expectations for those times. And lastly, it's important to differentiate between the things that we can control during these weird times and what we don't have control over. So practice today focusing on the things that we are in control of, such as turning off the news or creating new activities to do with you at home with your children, or just keeping a positive attitude. So those are some things that you are in control of, but there are a lot of things that aren't in our control during these times, and that's okay. Don't try and control for everything because you'll end up just driving yourself crazy. All right, so now I want to transition a little bit to talking about how to talk to your child about coronavirus. So before you approach the conversation, you want to think about how much your child's able to digest. You're an expert on your child, so you want to think about, will they be asking questions? For older children, they may have a lot of questions and some that you just don't have the answer to, but that's okay. A simple response of, we don't know, but lots of people are working on that. That type of response is all right. Try to approach the conversation in an open, supportive, and an honest mindset because there are a lot of differing stories going around, and you need to understand that your child may be hearing some conflicting things and they may be confused. And lastly, you just want to end the conversation on a positive note. You want to be able to walk away and feel like your child is less worried about coronavirus and that they got all their questions answered. Once again, I want to stress to think about how much information your child is able to digest. If you know that your child may not be able to understand in the way that we just discussed, you can also present it to them with these social scripts. So explain that the coronavirus may have symptoms that look like the flu, like a fever and coughing, but not everyone who is sick has the coronavirus. They might just have a cold or the flu. And then you can also explain that the reason why people are wearing masks and staying 6 feet apart in public is because coronavirus can be contagious and we don't want to pass it on to others and get them sick. So there's a whole PowerPoint with these very easy, digestible slides and visuals that the University of Miami's card services created. So if you would like for us to provide those to you, we can definitely do so after.
Okay, so COVID-19 has impacted everyone's mental health, and here are just some of the ways that it has maybe impacted your mental health. Grief is especially a big one. There's big community change, and there may be deaths within your community that's causing everyone a lot of grief. Stress. Finances are a big stressor right now, and even cleaning the house may even be a stressor for you because now, if you're working from home, that's your office. So, being surrounded with like a messy area may even create more stress. Anxiety is a big one. You're struggling with worries, you're trying to tolerate uncertainty right now, and that may create more anxiety, and having control over that anxiety may be a stressor for you as well. Mood, there's been a big shift in mood. You may have lower energy, you may have a lack of focus during the day, your sleep schedule may have changed, your appetite may have changed. This has had a big impact on your mood as well as behavior. For behavior, you may notice yourself looking at your surroundings a little bit closer, noticing other people, like if they're social distancing from you. This is called hypervigilance, and it's very exhausting to be very aware of your surroundings constantly just because you're worried about getting the coronavirus, as well as potential relief. Some people who already may be struggling with mental health, this may be providing some relief for them because they are being able to be contained in their house where they're most comfortable. So those are some stressors that COVID-19 has had. I don't know how to change it.
I can do it.
Next slide, please.
Oh,
Thank you.
Taylor.
Teens, let's talk about teens. They're experiencing this crisis very differently. They're still developing their brains, so their brains are still growing, especially within the frontal lobe area, which is in charge of problem solving as well as planning for the future. So tolerating this uncertainty is very stressful at this age for them. And also limited life experience. They're going through this with no experience, and they don't really have the benefit of having life experiences of maybe not knowing what's coming in the future. So this can be very hard for them as well. They also have undeveloped skills, and as well as social relationships. Their social relationships may have provided a little bit of stability for them, but now that stability is not present anymore because of this containment at home. And there's also finally a generational effect. Younger people now are dealing with stress in a much different way because of all the stress that they have went through throughout their entire lives. For example, school shootings they've had to deal with at this age, and now added to this COVID-19, there's a little bit of a generational effect with these teens. But also for teens with autism, combined with all of these things that other teens are experiencing, teens with autism has this added stressor. And I'll touch more a little bit about a major stressor for them with their changing their routine and changing their schedules later in the presentation. Next slide, please.
Okay, so now I'm going to talk a little bit about monitoring your child's anxiety. So here are some behaviors that parents should be on the lookout specifically during these times. So look out for regressive behaviors such as bedwetting, sucking your thumb, um, your children over relying on you for behaviors that they can do on their own, such as making their own lunch. You also want to look out for changes in your child's appetite and sleeping patterns because these tend to be the first telltale signs that something's not okay. So if you see big changes in these areas, definitely look out for that. Also, an increase in angry outbursts or sudden bouts of crying, irritability. These are all mood changes that you should also be on the lookout for. An increase in reassurance seeking and repetitive questioning is also an indicator of internal anxiety. So look out for that and be able to be there for them to supply them with that reassurance. Also, some kids may oscillate between acting very clingy and then be rejecting and withdrawing. These changes in attachment behavior can be common in difficult and uncertain situations, such as coronavirus. Also, look out for somatic complaints. So, kids' mental struggles tend to manifest in their bodies. So, an increase in stomach aches, headaches, less energy. All these complaints are real and should be addressed. Your child also may have more difficulty than usual with focusing on tasks. You may also notice an increase in moodiness or tantrums or emotional outbursts given the stress of the situation. So while all of these behaviors are common with stressful events such as coronavirus, this doesn't mean that there's nothing that can be done. So by fostering an open dialogue with your children, by validating their feelings, correcting misinformation, and offering reassurance, these are all things that we can do to nurture our children's emotional well-being during this time. And if you feel stuck, please reach out to mental health providers because there are still great resources for you during this time for telehealth.
Okay, so like I said earlier, modifying schedules right now can be very difficult for your teen to change their routine. So I just wanted to kind of touch on some ways that maybe you can establish a new schedule um, and promote a better understanding for your teen, because individuals with autism may cope best when their daily routines are only minimally interrupted. But because of this COVID-19, it was a big eruption. So, next slide, please. So here are just some suggestions to kind of establish a new schedule. I know we've been in quarantine for a while, but in case that you do need to make a bigger change, here are some suggestions. So using social stories to explain changes to the routines. Dependent upon the age and the functioning of your child, establishing a social story with words or even pictures may help them to better understand what's expected of them and their new schedule, and also allowing extra time in your schedule to accommodate these changes. So, because of these changes, there may be some maladaptive behaviors during transitions, and that may create a longer amount of time between going from activity to activity. So, allowing extra time in the schedule in case these things do happen is important to consider. Also using timetables and charts to explain the schedule changes. Um, there's in the next couple of slides, I'll show you some examples of those. Also, making small changes is important because you don't want to overwhelm your child in any way. You want them to transition as easy as possible. So starting small and then gradually building on those small changes is always a good option to have. Also, rewarding flexibility, it's important to keep in mind that it is hard to change their routine. So, as much flexibility as they provide you, make sure to reward that. It'll promote a better understanding for them as to what they need to do in the future for schedule changes. Um, Also, finally, create a calm down and decompression routine. Um, this is very important because you want to establish clear boundaries when establishing this new schedule and to promote a better understanding around the new schedule. So using all of these tips can help your teen to cope around having a new schedule right now. Next slide, please. So go back one, please. So this is just a visual schedule for like a morning routine that you can use depending upon the age and functioning. Like I said, it can be more words, it can be more pictures, just however you want. But this is just an example. Like you can see plainly they need to have breakfast, they need to shower next, get dressed after that, and then make the bed. This is just a clear visual schedule of like a morning routine that they would need to do. This is an example of a decompression routine. It's like a calm down checklist. I know it's a little blurry, but I did include this resource for you all to have. It says, when I'm frustrated, angry, or upset, I will choose to, and they have a bunch of different options here to calm down, like count to 5, ask for a break, take a walk, things like that, to kind of have in place a routine to kind of help them calm down. Next slide, please. And this is an example of a timetable. I know it's a little bit wordy, but depending on your child's age and functioning, it can even have pictures to help them better understand their schedule and what they need to do throughout the day. Next slide. And this is a weekly choices and goals. This is an example that your child can fill out to help establish a weekly schedule. So this will help increase motivation and to plan for things that they want to do. And it'll even help create structure for the routine. So knowing their motivation, knowing what show they want to watch, and knowing like a game that they want to play, including these things in their schedule can definitely help increase motivation and better their overall transitioning. Next slide, please. Okay, so I wanted to touch a little bit on how to transition off screens because I know there is definitely more screen time going on right now because of the COVID-19. So as much as possible, try to plan for screen time in the daily schedule and make the times reasonable for your child's age. So depending upon their age, you don't want them on the screen doing highly preferred things for a very long time because of their behavior, rigidity, and inflexibility when it comes to the screen. So it's important to consider an age-appropriate time, especially when they're doing schoolwork on the screen plus their highly preferred activities. Using a timer or clock to let your child know how much screen time they have left is very important because having those visuals when it comes to transitioning promotes more understanding about what is expected. And finally, try to avoid planning screen time before non-preferred activities. So for example, it may be easier to transition your child from screen time to snack rather than from screen time to an academic task. So just kind of thinking about what works best for your child and trying to plan for success when transitioning off of these screens. Next slide, please. Okay, and I wanted to kind of talk about kind of main ideas to have when planning their schedule. So it's important to keep in mind like the basics to promote better structure during this time of uncertainty. I wanted to talk a little bit about diet. It's important to maintain a proper eating schedule and continue consuming a well-balanced diet, and most importantly, limiting snacking, because I know when I'm bored, I like to snack. So kind of just keeping in mind monitoring their snacking just to keep their diet healthy. Staying connected, connect to your support network. Connecting with friends and family outside the home for 1 to 2 times a week to maintain that contact and most importantly avoid isolation. And finally, sleep hygiene. I know this is kind of like redundant. They probably already have a sleep wake schedule, but just to kind of keep in mind, they may not have to wake up at a certain time during the day. They may, you know, not have class early in the morning and stuff like that, but just maintaining a sleep wake schedule to establish structure at the beginning of the day and at the ending of the day. And that will promote a better daily schedule. Next slide, please. Okay, so keeping calm during this time is kind of like a no-brainer, but sometimes it can be frustrating tolerating this uncertainty. So just remembering to focus on the things you can control, like what Kayla mentioned earlier, and not the things you can't, because this can make a big difference in your overall mood. And also keeping active. This is really important. Even though the parks and gyms are closed, it's still remaining active is still a good activity to include in your schedule, like taking a walk or a run, and maybe even creating some games that involve gross motor activities that your child really isn't practicing anymore because they're having therapy on telehealth. So maybe something like freeze tag in the backyard or hopscotch can promote those gross motor activities. And it's also important to talk a little bit about how you ask them to do these activities. So framing your words in a more, like in a better way, like for example, saying, hey, I'm going outside to play freeze tag in the backyard at 6 o'clock. You can join me if you want. That is way better than saying, hey, let's go outside to play freeze tag right now. So just keeping in mind the way you frame your words. And then finally, staying engaged, learning a new hobby or skill. This can be a fun activity that your teen may look forward to because after an academic task that may have been really exhausting. So doing an activity that may be stress-free, and especially if they have a special interest in it, this can help kind of break up the day. Next slide, please. Okay, so I wanted to touch a little bit on managing their behavior during this time. Just a few strategies to keep in mind. Redirecting is a good strategy to prevent the maladaptive behaviors before they have a chance to act out those behaviors. Like if you see them kind of building up to get ready to have a tantrum or get really upset, maybe just redirecting them to a new task just to give them a break, especially if it's a really hard task for them to complete. And then taking a pause can help you respond in a calmer way. So just kind of taking a 10-second breather, this can help you respond in a calmer way, because remember, you're a model for your child. So if you respond in a calmer way, this may help your teen to have a milder reaction, or maybe even help them to calm down. And then finally, using consequences. Always make sure to follow through with these consequences that was given. And also remembering to give your child a chance to do something good after that, just to give them praise and help reward them for that, just to make sure that you're not like totally consequence, consequence, consequence. Just remembering to give them an opportunity to do something good so you can praise them. Next slide. And I wanted to touch a little bit on labeled praise. So there's important things to consider, like for example, proximity, being close to your child when you're giving this praise rather than communicating across the room, because they may not even hear if you're communicating across the room. And being enthusiastic and sincere. This is very important because you want to put as much energy as you put into them when they've done something wrong, and you're even more excited when they do something right. So just being enthusiastic and sincere is very important whenever you're giving them praise, as well as using nonverbal reinforcers like a high five, a hug, a pat on the back, just that stimulation from their touch, and including that with the praise can help for a good labeled praise, as well as being specific. I have an example down here. I really appreciate how you came inside right when I asked you to. This is very specific. They know why you're giving them this praise, and also keeping the praise developmentally appropriate. You don't want a long sentence for like a 5-year-old, let's say. Next slide, please. Okay, so planned ignoring. Planned ignoring works best when the purpose of the behavior is to gain attention. So you know your child, you know when they're trying to gain your attention. So planned ignoring works best when they're trying to get your attention in the wrong way. So by shifting the way that you respond to a child's behavior, you are changing their expectations, often very suddenly. So it's just a couple of tips for planned ignoring. So be consistent. This is essential when when you're seeking to change the unwanted behavior. Even occasionally responding with no or not right now to a child who is engaging in this attention-seeking behavior may give them just enough reinforcement to maintain this behavior. So just keeping that in mind, the consistency, as well as reinforcing other behavior. So when you reinforce the appropriate behavior, it's better than saying no, not right now, when you're reinforcing that inappropriate behavior. And then finally, prepare for an extinction burst. These are sudden and expected to increase in behavior and occur when extinction procedures are first implemented. So just kind of preparing for that extinction burst, because when you first implement something that they're not really used to, they may, their problem behaviors may get more exhaustive before they get a chance to calm down. So just kind of preparing for that, maybe having a calm down space that you have in your home, just something like that to just prepare for those extinction bursts. And then next slide, please. And finally, I just wanted to touch on picking and choosing your battles carefully, because during this time, it's kind of hard to just be battling with your teen consistently just because of inappropriate behavior. Just making sure that you pick and choose them very carefully, because not all behavioral missteps are worth fighting over. And it's important to also strive for balance during this time. There's a lot of not really structured things, and you're trying to create that. So just strive for that balance, as well as prioritize behavior. Focus on the behaviors and skills that are most essential. Include positive feedback and opportunities for success. I touched on this a little bit earlier. Also being resilient, because like I said, you are a model for your teen. So if you're resilient, they're more likely to pick up those skills. And also celebrate the fun and good things. Don't forget to celebrate, because this is a time of a lot of grief and stress, but just pick out those times that you really want to highlight, because that'll help better your day and your teen's day as well. Next slide, please.
Okay, so I am going to talk about a couple more strategies you can use for helping your teenager with coping. We've talked a lot about breaks, but I also want to stress that it's important for the break time to sometimes be scheduled. So for example, our teenagers right now, they are also doing a lot of schoolwork from home, and they're spending time on the computer. It's very, very hard to sustain our attention on a typical day, much less if it's on a day when we're also spending time on a screen. So it can be helpful if you have scheduled brain breaks for your child or teenager. So really helping them with maybe focusing for 15 minutes, and then they take a 5-minute break to sort of refresh. They can get up, they can stretch, get a snack. That way the break is short enough that they can then come back and transition back to what they were doing. You can also schedule breaks that are outdoors. So going out for a brief walk, or encouraging your teenager to go for a walk with you. If it's already planned in their schedule, then that's actually better. So if they know they're going for a walk right between 2 different academic classes, that's scheduled online, that might help them with coming back refreshed for that second class. For the walks, it can be helpful with individuals with autism for them to sort of have uh, a goal in mind for that walk. So if they know they're going on a scavenger hunt, for example, if your teenager really likes the outdoors, that walk could be a moment to notice some wildlife, to notice some trees, birds, bugs, rocks, whatever that interest is. So again, it feels more engaging instead of just walking. They can also listen to a podcast or an audiobook as they're walking if they really need that extra motivation for being outside. It's also important to have scheduled family time. So right now, a lot of parents, caregivers, they're also working from home. So you're also very busy and you're having to sort of time manage across the board. So it's important for you to also have this time with your teen. So having like a scheduled movie night on a weekend, or perhaps during the week, just sitting down and watching like a 30-minute episode of a comedy, that can be your time to really bond together, because this is also a great opportunity to develop that closeness with your teen. So I really think having this where it's a set time in your schedule in your week makes it easier for you all to commit to, because you already know that this is something you're looking forward to. There's also options for your teenager to listen to different podcasts or to engage socially on social media. It's very easy right now for everyone to feel isolated, especially teens. They're not in their classroom, they're not with their peers, they're only seeing them on screen. So it's helpful if they also feel that they can participate in maybe a live class, like a live exercise class, or just playing a game via Zoom or another type of social media app with their friends. That way they still feel like they're connecting and developing some of those friendships. This is an example of a game that you can also play with your teenager or middle schooler. It's really focused on a lot of different scenarios that can help with developing some of those problem solving skills for your teen. And again, it's focused on positive behaviors. So as you're playing the game, if you land on a certain square, that your teen has to then provide an answer before they can move on. So for example, if you land on L, a child stuck at home plays on her tablet while others are sleeping. She's tired the next day. Why is that a problem? So this gives you an opportunity as a family to kind of talk through this scenario and to see how your teen is really thinking about these situations and if they have solutions for these problems. This is also an activity that they can do with their therapist if they have someone that they're still seeing right now through telemedicine. So it's important to provide visuals as well, because again, our teenagers, they can get sort of stuck in their routine and they might think, well, since I'm home right now, my only option is to play video games or to just watch videos on YouTube or to just stay on my headphones, listen to music. But we really want to show them that there are still options, and maybe having a visual where you can present it as what's an indoor activity versus an outdoor activity might be helpful. This is especially a great tool for teens that maybe are just developmentally delayed or perhaps are having some cognitive difficulties. So having this very structured visual gives them choices, so they can see that actually there's still a lot of things that they can do indoors that's not on a screen. They can color, draw, read books, comic books, manga. They can play board games with the family, puzzles. They can work on a hobby, and for outdoors, they can do yard work with a family member. They can still play ball, right? They can take a walk or go on a hike. So these are just a couple, but there's so many other options that I'm sure you can collaborate on with your team. As far as exercise, again, having a visual presenting some of their choices might help, especially with those teens that have difficulty making decisions or taking the initiative. So showing them that indoors, perhaps today you can do a dance that you're learning on YouTube or TikTok. And then maybe in the next day you're doing some indoor yoga, or you're doing weightlifting using some supplies that you have in the home if you don't actually have free weights. For the outdoors, again, encouraging them to participate in a variety of activities that are still appropriate. They can still ride a bike. They can do jump rope. Again, gardening would be really nice now, especially before the weather gets really humid. And again, these are activities that they can do on their own independently or with another family member or even with a sibling in the home. As far as coping tools, it's nice to also have it presented as a list, perhaps as a checklist, because then you're helping them with developing those organization skills and with making it very simple for the teenager that might have difficulty with coming up with ideas on their own. So you can put all of it on a checklist. They can kind of check off what they've done that day or maybe what they're doing, what they've done for that week. Like I mentioned, there are also many apps that teenagers can use so they're still staying connected with their peers. And a lot of these apps are free. There's some that offer games, so they could probably play Pictionary or trivia games with their classmates. And again, that's a way for them to still feel connected to their same age peers, and so that they can maybe maintain some of those friendships that they had established in school. There's also many educational opportunities that are offered online that your teenager can either watch or participate in. A lot of museums are also offering virtual tours in case you have a teen that's really interested in history. For more movement exercise, again, there's so many free videos on YouTube. Yoga with Adrienne is also really great because she presents it in a way that's very easy to digest and understand, especially for beginners. As far as helping your teen stay consistent with their coping skills, it's helpful to kind of come up with that plan. So we've talked about a lot of different things that they can do for coping, but your teen might have difficulty relying on those strategies when they actually are experiencing anxiety or when they are feeling overwhelmed. So if they have this plan prepared ahead of time, then it's easy for you to sort of present it to them and for them to reference it in the moment when they need it. So that plan could include a variety of the things we've talked about, right? That when you're feeling anxious or upset, you have choices. You can take a break, you can maybe watch something funny, you can talk to a family member, you can go for a walk, you can engage in like some sensory activities. Anything that really will work for your teenager can be on this plan. Another thing that's often helpful for individuals with autism is giving them those helpful calm statements. They have difficulty identifying sometimes what emotion they're feeling and putting it into words. They also have difficulty coming up with some of these positive self-statements on their own. So if you have some of these already prepared with them ahead of time, then they can just sort of use it in the moment, right? It's very powerful to just say these statements out loud when you're feeling upset. So some examples could be, you know, for a teenager that's feeling very frustrated about being at home, reframing it so that they're not saying that, oh, I'm stuck or I'm trapped, but instead I'm doing what I can to stay safe right now. Or if they're feeling a lot of anxiety, you can have them have a statement similar to, I feel nervous, but this feeling is temporary. It's going to decrease. So some of these helpful calm statements can be developed, again, prior to when your child is actually feeling anxious. That way, they've got it. It's a go-to list. Perhaps it's already typed up. They can sort of look at it, or maybe you are reminding them of the things that are on their list. You can also practice breathing together. So diaphragmatic breathing is incredibly powerful. It's helpful to encourage your teenager again to do it when they are calm, so that they are already getting used to the routine of it. And then when they're actually feeling upset or overwhelmed, they can then do it and it's a little more automatic. So for diaphragmatic breathing, you really want to encourage them to take in a deep inhalation, right, for about 5 seconds. So they're slowly inhaling that air, and they're going to hold it for 5 seconds, and then they're going to slowly exhale. And you want to really stress the fact that they're doing it slowly because, again, this is giving a chance for your lungs to take in as much oxygen as possible. And you want to have them do this cycle at least 5 times. If they just do it once, it's not really effective. You're not really getting enough oxygen to actually feel relaxed. But if you can do it for at least 5 full cycles, that can be helpful. For teenagers that perhaps have really great lung capacity, they might even be able to do it for longer and really feel those benefits. Again, there's so many benefits. It can decrease tension, depression symptoms, anxiety, and it can really increase their ability to concentrate and to feel positive about what's going on in the moment. So individuals with autism often will have some sensory processing difficulties. And just to kind of quickly summarize some of these, sometimes it's sensory aversive, right? So they might want to escape a certain sound or feeling, sensation. So they might run away, cry, cover their ears, scream, right? And sometimes they might seek out certain sensations. So they'll spend a lot of time engaging in an activity that will stimulate those senses. Right now, in this moment, because they're sort of in just one environment at home, you might have noticed some changes in these sensory processing behaviors. So they're not exposed as they normally would to their peers. They're not in their typical routine. So because of that, some of these behaviors might have changed. So if you notice that your teen has some new sensory aversive behaviors, then you can then make sure that you have a plan for that, right? So if they have to do homework, or make sure that it's in a situation where they're not going to have as much distraction from that stimulation, because we want to help them to concentrate. So turning off the TV, closing the bedroom door if possible, checking that the lighting's suitable, making sure there's something distracting on their actual desk, perhaps using a noise canceling headphone. For those that are sensory seeking, you can have that time established, like that they can engage in that behavior, but make sure that it's happening before you have a planned activity. So before they have to do homework, or before you guys are planning a family meal, that can be the moment that they're really getting that free time to engage in that self-stimulatory activity. That way they're not feeling restricted, right? And that they're still getting a chance to do this behavior. So you also want to pay attention to whether they are seeming to be overloaded at all by any sensory behaviors. So have you noticed any agitation, any anxiety, any increase in behavior problems? Maybe you've seen some self-injurious behaviors or fatigue, and really try to rule out whether that's due to pain, right, or fever. You can also talk to your doctor to see if any of those symptoms are due to something physiological. If not, you want to ask yourself questions about the sensory processing difficulty. So is there too much sensory stimuli right now in their bedroom? Are there different senses that are being utilized for an activity that's really overwhelming them? Is it too intense? Is it lasting too long? You can talk it out with your team, because again, they're the ones that are going to know how they're feeling. And collaborate with them on how they want to get some relief if it does feel like it's becoming too overwhelming. So again, removing them from that unpleasant situation, helping them to calm down. This is going to require some trial and error, because some of these sensory processing difficulties might change on a day-to-day basis. Sometimes a solution that you used on Monday might not be effective on a Friday. So again, some trial and error might be needed, and really trust yourself. You know your teenager best. You've sort of been managing these behaviors for years, and you can also consult with their therapist if they're available to come up with some new strategies. It's also important at this time to make sure that you're managing any psychiatric medications that your teenager is taking. They might be reporting that they're actually fine, that they don't feel they need it anymore, because maybe they've noticed that they're feeling okay since they're at home with family. But you also want to recognize that sometimes we feel okay when there's a big stressor in your environment, but that feeling might be temporary. So really, it's important to make sure that the medication is consistent and it's being taken according to your doctor's approval. If you suddenly discontinue that medication, it might actually worsen their psychiatric symptoms. You want to also supervise how your teenager is taking their medication. If your teenager's stress level has increased during this pandemic, perhaps they're experiencing some harmful thoughts. So again, you want to be monitoring that. And that's also why it's important to make sure that the medication is kept in a secure location, and that you're ensuring that they're complying with taking their medication according to their treatment schedule. So really, what the main point is for this talk so far is that you all have so much power over how you can implement some changes in your home. Your teenager, they're independent and it's okay, and they can just do not agree with any of these suggestions that we've made. But because you might make some changes in your behavior, that might then help your teen. So for example, if you're showing them that you're taking breaks, that you're going on walks, that you've changed your own behavior for coping, they will notice those changes and it might then impact them positively. The language that you use is something that you have control over. So if your teenager has trouble regulating their emotions, you can, again, use your language to help with that. Often we can use language that is either overly protective or overly demanding when we're with teens that are very anxious. So an example of being overprotective could be like saying, oh, she's not able to handle the stress right now, or it's my job to protect him. By saying statements like that, they're hearing from us that we really don't believe that they can cope. And that's going to make it even harder for them to want to actually regulate those emotions and cope independently. On the other side, if we're being too demanding, it's also making them feel that we're not understanding their emotions. So if we're saying things like, it's not scary, I'm not afraid, so you shouldn't be, that's again reinforcing their belief that, you're not believing that they can cope and that maybe you're not understanding their emotions. So to make a great supportive statement, there's two really important components. Acceptance is super important, so validating the emotion that your teenager is expressing in that moment. And then the other part is expressing confidence. So the confidence is in their ability to cope. It's not necessarily confidence that the situation is going to change, because we actually don't know, things are so uncertain right now, but it's confidence that they can get through this moment. And if you put those two together, the acceptance and the confidence, that's really expressing support. So in order to practice, you really have to listen to those statements that you're using, or maybe statements that other caregivers are using in the home. So for example, you just have to power through. That's an example of confidence, right? Of telling them that, hey, it's just easy, you can get through it. It's not really an example of accepting that emotion. I understand this is very hard for you. That's a really nice example of acceptance, right? That you're validating the emotion that they're feeling. But we really want to put these two pieces together to make it more of a supportive statement. So I like to think about it as far as this example here to kind of help me sometimes with making sure that I have both components. So when you think about like macaroni and cheese, macaroni and noodles in general, they're delicious on their own, and so is cheese. But if we put them together, we get this great meal that's macaroni and cheese. So it's the same for putting together the acceptance and confidence, right? So the acceptance would be, I understand how hard this is for you. And the confidence statement can be, but I know you'll be okay. So overall, what you want to express is, I understand how hard it is for you, but I know you can do this, right? So putting those two things together really makes it more of a powerful statement, especially with a teenager that might be feeling very anxious. So obviously, if you have any comments or questions, you can always contact us so we can provide some more support. And we have here a list of resources and references. So the NSU card is offering so many different virtual groups and activities and events right now. There's also a lot of different toolkits available right now helping your teenager with their mental health. And we've got a lot of those here on this sheet for you, but we can also send some of these documents as PDFs if you need it. So thank you all so much for participating, and I hope that you were able to gain some useful information.